Let's get started then. Welcome, 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 welcome everybody that's on already. And we probably have another 40 or so people that we're waiting for. So hopefully as they join in, we should be able to, we maxed out on the number of people who wanted to be here today, which was sort of a surprise to us. So I'm thrilled. I'm just thrilled. And looking at the registration list, I'm thrilled to see so many names of people that I recognize. And I just want to say I'm so happy to see those familiar names. And I miss you. I miss you all. I really do. I know we're all doing a little self-isolation and distancing, and that's good, but it doesn't mean that we don't miss each other. So for those of you that don't know me, I'm Valerie Rochon, and I'm the President and Chief Collaborator for the Chamber Collaborative of Greater Portsmouth. And full disclosure here, as our staff will tell you, I am not a technology person necessarily. So we might stumble through a little bit on this Zoom meeting. Thank goodness for Zoom, huh? But please bear with us as we learn all the ins and outs. I've invited today the Portsmouth City Manager, Karen Conard, and the Portsmouth City Health Officer, Kim McNamara. And I just want to say thank you to Karen and Kim, who are working 7 days a week, doing all the heavy lifting behind the scenes. And I would welcome, even in your isolation, a round of applause for the amazing work that they are doing. So sort of like clapping tonight for the medical healthcare workers. Give a round of applause to our city staff who are doing just amazing things. Each of us are going to update you on what we've been doing behind the scenes, and then we'll open it up for questions. We are recording this, and we will share it on our social later today. You're going to be entering your questions when we get to the Q&A section through the chat function. It looks like it's private and it's just going to Ben Van Camp, which actually is true because he's our moderator. So feel free to use the chat function. Ben, when we get to that, the Q&A will be moderating, and we'll share your questions with City Manager, the Health Officer, and I, and we'll answer as many as we possibly can before 2 o'clock. For all of us, the world has changed in the last few weeks, and there's much to talk about, so excuse me as I read my notes because I don't want to forget anything. First, I'd like to say that I'm incredibly proud of our team at the Chamber Collaborative and the great work they've done to facilitate communications from the many, 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 many sources we are receiving information and then turning it around and sharing it on all our social media channels, updating our website, and now we have 3 times weekly outreach with a newsletter and 2 e-blast light outreaches. We have developed a COVID-19 page on our website, which you can access at portsmouthcollaborative.org/COVID-19. And there you're going to find important links. You're going to find links to the City of Portsmouth's COVID-19 resources page, the State of New Hampshire, the BEA business resources, SBA resources for those loans that we're going to be talking about, the New Hampshire Lodging and Restaurant Association resources, and the BIA, which is the New Hampshire State Chamber resources. So there's an awful lot of resources out of there. Thank you for sharing that screen, Ben. You can see that there's also links to our restaurants with pickup and or delivery options, which includes curbside drop-off and pickup for the retailers, businesses that are open and businesses that are closed. Note that we are updating these as we receive the information, but if you are planning on going to a restaurant or ordering from a restaurant, I would suggest that you call any of these businesses directly before you head out in that direction. The other thing on this page, if you want to scroll down a little bit, Ben, is that if you're like me, you're seeing stuff come flying fast and furiously at you. Sometimes I see something on Facebook that I want to go back and look at, and I can never find it again. So Jen and Ben are doing a great job of putting in these, you can see these orange links here. As we get information, we are putting it up here. So You see things from Department of BEA, the Department of Labor, from those folks that if you want to go back and find the information, this is where you're going to find it. So as much information as we can provide for you, we're providing it here. Ann Richardson of the Richardson Media Group reached out to us early on to suggest we start a Facebook group for our local businesses. This is a great idea. We reached out to our Seacoast Chamber Alliance members, the 500 other chambers in the Seacoast, and we launched Seacoast Strong Business Forum, a Facebook page with now around 200 members who share questions, best practices, concerns, and resources as we find them. Please go take a look at it, see if it's of value to you. I find it valuable. I look at it every day. It is being managed by all of 5 of these Seacoast Chamber Alliance members. So please take a look over there and see if that's a useful resource for you. I think you'll find that it is. We had at one point, at the request of the governor and Commissioner Caswell, reached out to our manufacturers to find out if they were willing to retool. And Nancy Karma just shared with us this morning that Next Phase Medical over in Rochester has retooled, is ramping up to provide resources for our healthcare services, and they're looking for about 100 temporary workers for the next 3 to 6 months. So we'll put that up on our jobs board. We've really ramped up our jobs board so that those that are looking for jobs, many of our staff or employees have been laid off. And so we've ramped up our jobs board. So if you are looking for work, please go and take a look at our jobs board on the website, portsmouthcollaborative.org. And if you have jobs, if you are looking for some of these fabulous employees that have been furloughed or laid off, please either go in and post your own jobs or email to me or to Jen or to Ben, and we'll get those jobs up there for you. I think Jen is managing that board for the most part. I want to, let's see. Finances. I know a lot of us are scrambling now as the Paycheck Protection Plan opens up today for folks to get loans, which will be forgiven if you bring back your employees and keep them on your payroll. The CARES Act allowed for financing for a number of things: the Paycheck Protection Plan, the Small Business Debt Relief, 7A loans, 504 microloans, small business counseling and training, the Economic Impact Disaster Loan, and a $10,000 grant for the Emergency Economic Injury Grant. So there's an awful lot of information that's out there, and you can find a lot of this at sba.gov/NH. Let me just share with you that in a conversation that I had today, we have a weekly conversation with Commissioner Caswell at the BEA and New Hampshire Association of Chamber of Commerce execs, and periodically the governor jumps on and off that. We also have a weekly conversation with New Hampshire Travel Council, and what we learned today is that all the SBA and many of the resources are absolutely slammed. And if you want to reach the SBA, one person said that they actually did get to speak with somebody at 4:30 in the morning. So, and what that person told them was that it might be 3 or 4 weeks before they actually process your loans, or before they actually get to speak with you, and then it might be 36 to 48 hours before they process those loans. So their advice was, work with your local banks. Reach out to your local bankers. Those banks that you usually work with, they might be your best resource. Many of them, if they're preferred lenders, since the PPP opened today, might be somewhat slammed today, but you might want to try reaching out to the folks that you normally work with starting next week. So I could probably go on for another 15 or 20 minutes talking with you about some of the information that we've learned and that we'd like to share with you. But I think it's important to hear from our city manager and from our health officer. So if I can turn this over now to City Manager Karen Conard. We're just thrilled that you're here with us, Karen, and over to you.
Thank you, Valerie. Appreciate it. And as much as I'm glad to have the microphone for a couple of minutes, I really want to yield most of my time to Kim. She's one of the smartest people I know. The city could not be in better hands with Kim as our health officer in both good times and in times of pandemics such as this. I really just want to make people comfortable with the fact that the city government is covering this like nothing I've ever seen. The team here is unparalleled, and between Kim as our health officer, Chief Germain in the fire department, and Chief Murner in the police department, and all the other city departments, we are working nonstop to stay connected with one another, to stay connected with the state's emergency operations center. We have regular check-ins with folks such as Senator Shaheen and Governor Sununu, and we are always speaking with Portsmouth Regional Hospital, as well as our Seacoast community partners. The New Hampshire Municipal Association has been great in sharing information amongst city and town managers like myself. Kim is coordinating with a host of folks you may or may not think of, such as nursing homes and funeral homes and all of the people related to what is going on right now. So I'm so proud to be here, not necessarily talking about something like this, but to represent the team in this effort. It is truly amazing to watch these folks work together so well. So it's wonderful to be here representing the city. Couple of things we want to share. This week we were encouraged to see that the county data on COVID is turning into community-specific data, but we will caution that we're always looking to maintain the accuracy of what information is out there, and that we are putting out accurate information. And to that end, we have a team, most notably led by Stephanie Secord, our public information officer, that puts together the City Daily Advisory. So I would encourage all of you who are not yet signed up to do that. It used to be a wonderful weekly newsletter, and it's turned into quite something else during this time. So if you haven't yet signed up, go to the City of Portsmouth's website, which is cityofportsmouth.com. You type newsletter into the search bar, and you'll see the first item that comes up says, welcome to the city newsletter. Click that, and you enter your email address, and it's as simple as that. So before I turn it over to Kim, I just want to mention that our Economic Development Officer, Nancy Carmer, has done a great job of staying on top of this and staying coordinated with the Chamber. And she has prepared and found a good website that summarizes the CARES Act, because this can be so confusing. We will post that in our daily advisory today, and moving forward, it will also be on the city's economic development page. And the last thing I want to say before I turn it to Kim is there's that Clap Because We Care event going on tonight at 7. We've asked churches to ring bells. We've asked the Port Authority to encourage anything that makes noise in the harbor to participate. And I think a fun way to celebrate what we all experience would be to try to take a video of what you are hearing and seeing and send it to, send it to me, I think. And I'll help coordinate how we get a montage of all that, hopefully incredible energy. So with that, thank you, Valerie and the Chamber, for putting this on. We love being a partner with you in this effort. And with that, I would like to turn it over to Kim McNamara, our health officer.
Good afternoon. I've been asked to give you an update on the COVID-19 situation and considerations for business community as we move through this very difficult period. So today I will review the current New Hampshire situation, reasons for the current restrictions, how this is affecting our community, and how to begin planning for recovery and resiliency, and what the business community can do to help this region get through this hardship and lessen future impacts of disasters. As of 11:33 this morning, Johns Hopkins University reported 1,041,000 confirmed cases worldwide of COVID-19. The situation report for New Hampshire, and these are released every evening, so as of last night, 479 persons in New Hampshire were confirmed to have COVID-19. 5 deaths have been attributed to the disease, which is about 1%. 73 people have required hospitalization, and that translates to about 15%. 6,575 people have tested negative, and 1,700 New Hampshire residents are being monitored. As of yesterday, Rockingham County had the most confirmed cases at 170. But the numbers in New Hampshire are going to grow. These are actually artificially low because testing is inadequate, and there are questions about the accuracy of test results. But what this illustrates is we have moved from individual transmission from known cases or travel-related infections to widespread transmission in the community. The profile of COVID-19 continues to be that seniors with underlying medical conditions are being hit the hardest, but even some young, healthy individuals with no known underlying conditions are suffering severe illness. And all ages can contract COVID-19, but the mortality rate clearly climbs upwards with people over 60. And although it's not completely the case, thankfully, children up to 9 years old seem to be very, very low rates of any sort of poor outcomes. We are under extraordinary measures to try to slow or stop the spread of COVID-19 from person to person, and there are several reasons for doing this. The first is to ramp up emergency response systems. As Karen was mentioning, there have been numerous emergency management conference calls between all of the groups involved, and there's an effort to provide the most accurate information available, build a volunteer workforce, and procure equipment and supplies. Another reason is to increase the capacity to detect the virus. More test swabs and reagents had to be produced, and newer tests are being developed that will provide results much more rapidly. Another reason is to increase the capacity to care for patients. There is an alternate treatment site being set up in Durham to provide care for patients in our region that are healthy enough to be discharged from the hospital, but cannot go home yet. This frees up hospital beds for more patients with more serious and severe symptoms. Also, this time is to develop life-saving medical interventions. There is a severe shortage of ventilators, which are a necessary piece of medical equipment to fight severe respiratory symptoms. And some vaccine options are in development and ready for preclinical trials. However, there are many additional steps still needed to bring them to market, including clinical trials to see if they are first safe and then secondly effective. This will take months, if not years. Remdesivir is an antiviral medication originally developed for Ebola. It is in clinical trials currently, and if this drug shows effectiveness, it could potentially be available within a short time frame. There are other drugs also in development, and convalescent serum, which is a blood component of people who were infected, is also being evaluated for treatment options because theoretically, it carries the antibodies to fight COVID-19. These measures are also an attempt to avoid overwhelming the healthcare system, which at this point is probably unavoidable. It's also the purpose is to minimize the impact on social services and the economy, which are already taking a huge hit. How is this affecting our community? Well, of course, the personal economic health of many of our residents and workforce is pretty fragile at the moment. There's been a tremendous disruption of service and supports, such as transportation and supportive care to individuals. We will probably have some businesses that do not reopen. We will have others that rebrand themselves and creatively adjust to the situation. If nothing else, area businesses are incredibly creative. I heard of one local restaurant that was giving a free roll of toilet paper with every takeout purchase. Now, that just smacks of Portsmouth. We cannot predict how large the effect will be on us. The only way past this, unfortunately, is to trudge through it. Much of the outcome is going to depend on how responsible every single one of us is in being in response. Responsibility comes in many different forms. Citizens that overwinter in warmer climates should delay coming home until this is over. Responsibility also means us not visiting the grocery store every day, postponing traditional celebrations such as birthdays and Easter gatherings. And for persons who are particularly at risk, don't go to work even if you're deemed essential. Speak up when your neighbor or coworker is too close. Pay attention to your own health. Every single one of us has to work together for the best possible outcome for our communities. Now, looking at this from a planning perspective, you have to plan in stages. For now, think that we may be in this holding pattern of staying home through May. It's probably a good time to be planting a garden. We'll probably arrive at a point around then that we will understand if we've gotten through the peak of illness in the community, and if so, we can start easing restrictions on ourselves. Those restrictions will probably be lifted in increments. Perhaps certain groups will return to work and outings before others. Younger, healthier persons without underlying medical conditions may be the first wave. Perhaps outdoor activities will be among the first things to come back. However, persons in high-risk categories may decide to continue with the more conservative measures until there are lower levels of new infections occurring or antivirals or vaccines are available. For right now, in the next 8 weeks, you should plan to be as conservative as possible. Grocery shop only once a week or every 2 weeks. Do not socialize. Don't let people into your space. Don't commute together if you're essential. Sleep well, eat well, take care of yourselves. If infection rates will eventually drop off, we will have to see if COVID-19 becomes endemic, which means that it will have a level of persistence in the population like influenza viruses do, or will it disappear from the human population altogether like some other coronaviruses did. If it's still present, then rates will drop off while we are still essentially quarantining ourselves. And when we start moving about and opening up the community again, we have to watch carefully for infection rates to start creeping up again. Research indicates that antibody titers, which are the immune factors that our bodies produce in response to infection of the related viruses, the SARS and the MERS that we've experienced earlier, antibody titers were either weak to begin with or they waned after 2 to 3 years. So after enough of the population becomes infected, there will hopefully be a level of immunity in our communities, at least for a period of time. Ideally, the goal of vaccination campaigns is to create herd immunity, and that's HERD, like a herd of cows. The principle is that if enough of us are immune to a disease, then it can't penetrate past us to reach those who are not immune. Therefore, by me being protected, I'm also protecting you if you cannot get vaccinated or if your body doesn't respond strongly enough to vaccine. There is much that the business community can do to help our region get through this hardship and lessen future hardships. First, please support your local emergency response planning and training efforts. A responsive government not only provides the basic daily services required to run a municipality, but also has the talent and foresight to plan for and adequately respond to crises. Emergency response doesn't just mean the immediate response of police and fire to accidents and crime, or DPW cleaning after a severe storm. It also means an all hazards approach to planning for, responding to, and recovering from disasters. So supporting these local government functions will make us all more resilient. Build resiliency in the business community. Attract, support, and advocate for local resources. The entire country is competing against itself right now for equipment, supplies, and workforce to combat this pandemic. We are far too dependent on overseas companies for everything from materials, supplies, equipment, and even basic goods and services not related to healthcare. If China is closed because of an outbreak, and several outbreaks occur in China, then so many of our businesses can't get what they need to continue to meet the needs of our communities, whether it's electronics, building materials, replacement parts, etc. Also, build resiliency within the individual businesses themselves. Businesses should draft a business continuity plan that includes being closed for an extended period while remaining viable to reopen once a crisis is over. And a crisis can be anything. This is certainly a crisis, but there could also be an explosion that destroys infrastructure or contaminates an area surrounding a business. Build resiliency by telecommuting on a regular basis. Allow employees to work remotely on a routine basis so that you can be practiced at telecommuting. And you can be sure that you have the necessary equipment and access, and don't lose precious time in an emergency to slowly transition to the ability to work off-site. Design economic choices that support a clean and healthy environment into your mission statements. In this and any crisis involving persons becoming ill or injured, our healthcare system can become overwhelmed and unable to provide life-saving care. Human health is inextricably tied to our environment. Underlying medical conditions can create severe disease. Chronic obstructive pulmonary disease, or COPD, asthma, lung cancer, heart disease, and many other chronic conditions can be caused or exacerbated by environmental conditions such as poor air quality, and that's just one. So economic decisions absolutely affect environmental and human health. Making business decisions that support clean and renewable energy, eliminate plastics and toxic compounds, build a local supply chain instead of products being transported across the globe are just a few examples of how to improve our environment and health and help to build a more resilient economy and community, because if our hospitals are not routinely filled with patients suffering chronic conditions, they have much more ability to accept and care for a surge in patients due to an illness outbreak or a major disaster. I would also like to introduce you to the concept of closed pods. That's PODS. PODS is an acronym for point of distribution sites. In a large outbreak that we have medications and vaccines available to treat, we as a city would set up mass vaccination clinics, such as at the high school, where we could have hundreds of citizens come through in a short amount of time to receive medications or immunizations in preparation or response to an outbreak. This is done in outbreaks such as bacterial meningitis, influenza, and hepatitis, just to name a few. However, individual businesses can host closed pods for their workforce specifically. For example, an office building that holds 5 businesses and 40 employees could have a public health nurse come to the office at a specific time and offer vaccination to all of the employees, perhaps even their families, all at once. So the business does not have to host the general public. So this is a very efficient and convenient way for businesses to build a protected workforce to ensure the continuity of their businesses and the health of the local economy in times of outbreaks and high levels of community illnesses. Understanding where we are currently and why these extraordinary measures are in place should help you to know, for all the reasons given, that by having patience and participating wholeheartedly, you are doing the best you can for your community. Planning for recovery and building resiliency is something you can be doing now. In disasters, the local response and recovery is the most telling of how a community survives and thrives in the wake of such trials. Thank you for your time. I look forward to continuing these conversations with this very important group as we move through the response phase of this pandemic and into the recovery and resiliency phases.
Well, Kim, thank you so much. I have to unmute. Okay, looks like bear with me. I'm unmuting. Okay. Kim, that was such a great comprehensive report. And we know, I know that you're working around the clock 24/7 to work with other organizations and learn as much as you can. And as we all know, the world is changing hourly, not even just daily, but hourly. And I know that you're on top of all of that. So thank you so much for that. And City Manager Conard, thank you so much for all that you're doing as well and for joining us today. So I think that I'm going to ask Ben to, he's got some questions. I believe that people are already asking questions. So Ben, you want to jump in and moderate those for us, please?
Sure, we do. The first 2 questions look like they're best answered by Kim. Put Kim back up here. So the first question is, does the virus stay with people after testing positive for more than 14 days? It has been said that even after a negative test, it stays with people for 8 days more.
Well, there are a few different issues there. One is there can be tests that are done too early in the infection process that will come up negative. Sometimes some providers prefer to test after day 7 to get a more accurate result. There's just some built-in inefficiencies in some of the testing methods as well. So the thinking is that from the time that you start symptoms, you absolutely should stay home and away from people for at least 7 days, and then again 72 hours after the last sign of any symptom without medical or medication help to alleviate those symptoms. So if you still have a cough, wait 72 hours until after that cough is done, and as long as it's at least 7 days when that time begins from when you actually begin with symptoms. I'm not sure if that answered the question.
I think that got us pretty close. Let's see, you got more questions coming in here. Are there any plans to build overflow beds for hospitals closer to us than Durham?
Well, that's a function of the state emergency operations center, and they're still developing their plans. So I know that they're opening more of these alternate treatment sites, but what level of care that they're offering is not certain. The one in Durham at UNH, I understand, is for very low acuity patients, but there are others that I think are for higher levels of care. I just don't think it's fully planned yet.
Okay. And this question, maybe for you or maybe for Karen, so I'll let you guys wrestle that one. Do I understand that the recommendation is for all businesses to plan to stay closed, I assume to the public, through May?
Well, I think that we have to expect that that may happen. There's no firm edict that happen, but we really have to watch how this plays out over the next few weeks to figure that out.
Okay. And then since you're up, Kim, we'll keep going here. There's a question from North Sturvant at JSA Architects. I think he's commenting on your statement to only go to the grocery store once a week or every 2 weeks. And he said, from a practical standpoint, once weekly shopping could create a hoarding cycle, which we are currently struggling with. How do you think we can balance those competing demands of social isolation and maintaining adequate supplies on the shelves?
Yeah, that's a good question. First of all, I just want to assure people that there has not been any indication that there's any problem with the food chain. The hoarding situation seems to be a bit of an overreaction. Generally, hoarding is people are supplying themselves for a month, 6 months, that sort of thing. But it's very difficult also for people who like to eat fresh vegetables. You know, I buy vegetables today, and a week from now, I'm not going to want to eat them. And I'm struggling with that myself. But the reason for that is because there's just less exposure.
Great. Next question is it preferable to drive through a testing site like the one at Pease or to go to a medical facility?
Well, I think that there's still some plans being worked out with Convenient MD for either expanded testing other than first responders and healthcare workers. So in a situation where they come up with maybe plans to expand that, that might be a good option. But right now, people should not be going to the emergency room just to get a test. That's not going to help the situation. And the drive-through testing is actually for people who have appointments, people who have exposures, and there are some priorities on those. So it's really working with your own personal care provider to decide for whatever your situation is, what is best to do.
Great. Next question is, the fire department has a list of supplies needed that they posted along with some delivery times. Where can this information be found, and where can things be delivered to if people wanted to make a donation?
Well, there was a PPE, personal protective equipment drive that was set up for Thursday, Friday, and Saturday of last week. So that drop-off time I don't think is open currently, but of course, any supplies that anybody wants to donate, call Todd Germain at the fire department, call me. Very happy to take them, and we'll make the arrangements to make a time available that's convenient for people.
If I can jump in here to say, if we feel the need to reach out and have another drive, we will do that. But in the interim, it's great to follow Kim's advice, contact her, and we can get what people have to the fire chief.
Next question, and Karen, with you being here, this might be perfect. Understanding that this is a day-by-day changing situation, is there a drop-dead date by which the city will need to make a decision about planned public activities in Prescott Park, such as Prescott Park Arts Festival or use of the Chafee Warehouse in order to properly plan for everything to take place?
Great question. Wish I had a crystal ball for that. We talk constantly about both the one-time events and the recurring events, and we are taking these on a wait-and-see basis. I won't be ruining any surprise, I don't think, to mention that the Children's Day event that Pro Portsmouth puts on is canceled. What they're debating next is what to do with Market Square Day. So we will continue to have these conversations as they move forward. Some events need advance notice and advance planning to either postpone or cancel. It's really on a case-by-case basis, but we are incorporating that conversation into the daily, more logistical COVID type conversations. That's the best answer I can really give right now.
Good non-answer answer. So next question, is there a general timeline when New Hampshire, feels that there will be adequate testing for the state?
I don't know. I'm not sure that there's going to be adequate testing. Maybe if we get through this first wave and enough methods that are reliable are developed and produced, then, you know, beyond June or something, maybe we'll have that sort of capability. There are local companies that have stepped up, and I believe Dartmouth Hitchcock is part of that, for developing better testing procedures with much more rapid results, and it's certainly needed. But I can't speak for the state as to when they think that might come to fruition.
Okay, next question. We have a couple questions about parking, so we'll go back to Karen for these. People are curious if is the free parking going to end? Is there, if it does end, would the city consider a 15-minute grace period so that people could get takeout at local restaurants?
You sure I can't punt that one to Kim? Because I'd really like to. No, let me take it backwards. It's our intent to support the businesses open for takeout and delivery. So we will preserve that in whatever means we need to. The current parking holiday, if you will, runs through this coming Monday night, when the city council will meet and hear from our parking director, Ben Fletcher, about the impact that that's had and the thoughts moving forward. What I can tell you is, in looking around, and I have quite the vantage point, there aren't a whole lot of cars downtown parking. So don't want to make any predictions about when free parking will end or when paid parking comes back. Again, something we're looking at carefully. What we don't want to do is harm the businesses, and we want to protect those staying open with the takeout option.
Okay, that's the end of the questions that I have.
Okay, unmute. Oh, there we go. Am I unmuted?
Yes.
Cool, thank you. So thank you so much for all the questions. And I know that Kim and Karen and I will be accessible for emails and calls. And, you know, if you have additional questions, please reach out to us. Actually, I shouldn't say Kim, I shouldn't speak for Kim, but I know that Karen has been incredibly receptive to outreach, even though she's incredibly busy. So I'd like to address one thing that was brought up this week, or gets brought up a fair amount. Actually, there was an editorial in the paper this week about not welcoming visitors and you know, go home. And there's actually a group up north that have a tagline now that actually says, "Please go home." And I'm not sure that, you know, that's a fine line for us, right? We want to make sure that we all stay safe, and you know, as Kim talked about earlier, as you know, as folks are coming back from Florida or wherever they're coming back from, and we want to make sure that they go into quarantine and all of that. It's a fine line. These visitors are the ones that keep our economy going in a lot of ways. And so while we want to be responsible, we also don't want to tell them that we don't ever want to see them again. So I know that the chamber is not doing any marketing, and nobody that we spoke with during our tourism committee this week is doing any outreach marketing. The state is not doing any outreach marketing. They've actually pivoted all of their outreach marketing resources to in-state communication to try to keep the NH economy .com/COVID-19 website up to date. So if people think that we're out there trying to drum up business, we are not. And but we also want to make sure that we're ready for these folks when they come back. So and that brings up the sort of the new normal. What will the new normal be? And we are all thinking about what we're going to be doing as we approach recovery. And recovery, as we know, is going to be just as we ramped down. It's going to be a ramp up. We're not going to flip a switch. It's not all going to happen at once. And I think Kim spoke to that a little bit. One of the things that we need to be aware of is that many of us are looking at the events that we had scheduled for March, April, May, even June, and moving those into the fall. And we're starting to have discussions about how many events are we going to have to go to in the fall, and will there be even capacity for those folks that can hold events to do that. And the other thing that I think that we have to be aware of is that many of our nonprofits, our arts community, our restaurants, our hotels, our attractions and activities, there will be events that will be fundraisers for a lot of these folks. So not only will we have our normal events that we're trying to move, but also fundraisers for these folks. They're ongoing now, and I suspect that they'll continue going into the fall. So be aware of that if you're trying to move an event. Maybe it doesn't need to happen in the fall. Maybe it needs to happen in the spring, or maybe we can come up with some very creative winter events that we need to be thinking about, because we can't do all of these events in September and October. We don't even know what September and October are going to look like. So just asking people to be aware of that. I do want to tell you about next week. I'm really excited that we have such a great group with us today. Next week, we'll have Nancy Carmer, who is our economic development manager for the city, and of course works very closely with our businesses and small businesses. We'll have a representative from the Small Business Development Corporation with us, and we've invited one of our financial institutions, because by next week we want to be talking about the loans that are available or not available. There's some concern that the PPP loans will be fully obligated by next week. So if you are going for a PPP loan, get that in. Make sure you're using the form that came out this morning. There was a form for the PPP loans that came out last night. That's no longer valid as of 9:45 this morning. There's a new loan. Make sure you're getting the new loans, the new forms to submit for those loans, and get them in as fast as you can. Again, you can reach out to your local financial institutions to just try to chat with them about it. Although, again, today I know that they are just absolutely slammed. I just want to say that all of us are in this for the long haul. United we stand, divided we fall. And the fact that we can work together and can communicate with each other and collaborate in any way, shape, or form that we can, to the extent that we know about those collaborations, we are happy to share. As I said, keep an eye on our website, portsmouthcollaborative.org. And the city, that daily newsletter that Stephanie's putting out is just so valuable. So make sure that you sign up for that. I want to let you know that we have a fun surprise for you at the end of, as we close up today. So please stay on with us for a few more minutes. I want to thank Karen and Kim and all the city staff for the work that they're doing behind the scenes and for being with us today. I want to thank our staff, our chamber staff, that I know is working furiously. As we've said, we've been drinking through a fire hose for 2 weeks now, and we don't see that slowing down. So we will continue to turn information round for you. And I thank you all. I ask you to stay on for another moment. Ben's going to load something up for us, and we should all enjoy it and walk away with a smile on our faces. So be safe, be well, and we'll see you next Friday at 1 o'clock, if not before. Thank you.
There's no sound, Valerie.
Thank you for breaking that. There we go.
When I had you to myself, I didn't want you around. Those pretty faces always made you stand out in the crowd. But someone picked you from the bunch when that was all it took. Now it's much too late for me to take a second look. Oh, baby, give me one more chance. Won't you please let me back in your heart? Oh, darling, I was blind to let you go. Now that I've seen you in your arms, oh, I have a move. Do it together. It's from Greece. You like these? Yes. Oh,